Welcome to this week's edition of Africa 360, the show that brings you the issues that matter. I'm Kwangu Liewewe. Over 1,000 people have died in the West African region in the worst Ebola outbreak in history. It began with a handful of cases in Guinea 4 months ago. Since then, the deadly disease has spread to neighboring Sierra Leone and Liberia. And now, Nigeria is affected. Before we go deeper into our discussion about this deadly disease, let's have a look at what Ebola is. Ebola is a tropical disease, one of many hemorrhagic fevers. The Ebola virus is named after a small river in the Democratic Republic of Congo. It can be fatal in humans with a fatality rate of between 50 and 90%. So the chances of survival are minimal. Research shows the disease has mostly been found in remote villages in Central and West Africa, near tropical rainforests. It is contracted through human-to-human transmission, and this means it's not transmitted through the air, as some fear, but only through contact with bodily fluids. No medicine or vaccines exist for the disease. Let's take a look at the symptoms of Ebola. Some of them include sudden fever, intense weakness, muscle pain, headache and sore throat, vomiting and diarrhea. Bleeding is also a symptom in some cases. This shuts down organs and causes unstoppable bleeding from all orifices. In response to the largest outbreak of Ebola ever recorded, the World Health Organization has declared it an international public health emergency. The Global Health Organization continues to monitor the spread of the virus in the West African region. eNCA senior field producer Tumaole Motlaudi has been following the outbreak closely. He brings us up to speed with the latest developments.
Now, the first recorded Ebola outbreaks occurred in 1976 during two simultaneous epidemics in Nzara, Sudan, and Yambuku in the Democratic Republic of Congo. Since then, its ensuing outbreaks have been devastating.
However, the latest occurrence, which started at the beginning of 2014, is considered by many experts as the worst in recorded history. Many continue to die, whilst those newly infected by the deadly hemorrhagic fever desperately fight for their lives. But there is little hope for those who contract the horror virus. Chances of surviving an Ebola infection are almost zero. The hemorrhagic fever has a fatality rate of between 50 and 90%. Since the first case of the most recent outbreak was reported in Guinea, Ebola has spread quickly, resulting in over 1,000 deaths in West Africa. Guinea, Liberia, Sierra Leone are the hardest hit countries. But Nigeria is the latest country reporting new cases of the disease. Panic has spread quickly among local communities, prompting embattled governments in the affected regions to announce tough measures, which include temporarily closing schools and the quarantine of the remote forest region believed to be the epicenter of the outbreak. A state of emergency has also been declared in Sierra Leone, Liberia and Nigeria as part of the multi-state preventative measures.
One of the things that was decided was to place these areas under closer scrutiny in terms of limiting travel into and out of those particular areas, but also supporting and improving health provision in these areas.
As the West African region grapples to contain the worst outbreak known to man, the international community has also stepped in to assist. The World Health Organization has pledged $100 million in emergency funds as a joint response plan for the three most affected countries. African Development Bank has committed $60 million and the World Bank about $200 million. While international efforts to help seem to have intensified, other regions in Africa are also now on high alert. The Southern African Development Community recently convened an extraordinary meeting of health ministers in order to come up with a joint response strategy in the event of an Ebola outbreak in the region. South Africa has been chosen as a regional center for tests and analysis in case of an outbreak in the region.
Here in South Africa, we've already been screening people using the thermal scanners. We've already selected hospitals here that we are busy preparing in case, just in case there's any patient who has got Ebola. It's not going to go to any hospital. We've already selected the hospital, we are busy preparing them. And each of the countries here is going to do so.
With growing concerns over new cases being reported in Nigeria, there are growing fears that Ebola could spread to other parts of the continent through air travel. There could be good news though. With demand for and questions about untested treatments growing after 2 infected Americans received some, the World Health Organization has given the green light for the use of experimental drugs to combat the Ebola outbreak in West Africa.
Now, several potential vaccines are being tested, but it could be several years before there is any available to treat the virus. However, experts say supplies of both an experimental vaccine and the experimental drug called ZMapp are limited, and it could take months to develop more supplies. Canada, on the other hand, says between 800 and 1,000 doses of the vaccine, which so far has only been tested in animals, will be donated to the World Health Organization, WHO, for use in West Africa. And with that, it's back to you, Kwangu.
Some interesting insights there about Ebola, the disease which is tormenting West Africa. Well, join us after the break, because when we come back, I'll be joined by a panel of experts to take the discussion further.
I don't shake people anyhow any longer. So even if I'm in the bus, if I see a passenger that is sitting beside me, I sweat and I'll somehow shift a bit to avoid it.
I don't move around. I don't go close to people the way I used to go. I used to go close to people. I just stay on my own now, for now.
I wash my hand every time. In fact, I can't even count the number of times I wash my hand. I'm even tired.
I can't near people as I do before. Now I get to meet one of my friends yesterday I've seen for 5 years. I was unable to hug the person.
Welcome back. You're watching Africa 360, and today we're focusing on the outbreak of Ebola in West Africa, which has been described as the worst in history. I'm joined in our Johannesburg studio by Dr. Lucille Bloomberg from the National Institute for Communicable Diseases here in South Africa, and James Kambaki from aid agency Doctors Without Borders. Also joining us from our Pretoria studio is Dr. Sarah Barber, the World Health Organization's representative in South Africa. Thank you all for joining us. Now, Dr. Barber, I'll start with you. The World Health Organization did declare the Ebola outbreak as an international public health emergency. What exactly does this entail?
Well, the declaration of a public health emergency of international concern implies that this is an event, a public health event, which could affect other member states, that it has the potential for international spread, and that it requires a concerted international effort to overcome.
Now, is that just a statement, or do we expect to see more action on the ground in these affected areas?
We do expect to see much more action on the ground in each of these, in each of the 3 sets of countries, those countries where Ebola transmission has occurred, those countries that are bordering member states, as well as all member states. The committee set forward a series of recommendations for each of these countries to follow. And they're very concrete recommendations to address the outbreak and prevent it from spreading internationally.
Dr. Bloomberg, maybe you can come in here. It's been 4 months since the outbreak was first heard of in Guinea, and we've seen it wreak havoc in most of West Africa now. What exactly triggered this one off?
Well, I think it started in December in Guinea. And probably started in a bat in a forest, and somebody who went into the forest and either caught a bat or some other animal that was infected, and enjoyed some bushmeat and got infected in the process, and then may have presented at a hospital or in the home setting, got cared for, and in the process transmitted the infection to family members with direct contact.
Now, in the 4 West African countries, maybe Mr. Kabaki, you can come in here. The 4 West African countries that have been affected have poor health facilities, especially public health facilities. And when it comes to infection control, they don't fare too well. How is this affecting the outbreak of the Ebola virus?
It's really been a very challenging intervention as far as MSF and Doctors Without Borders is concerned. This is because since we started this intervention in March, we have not managed to contain it in a way that is actually expected to, simply because there's, as you say, the health institutions is really overwhelmed with an additional burden, whereas there was malaria that was already a burden in these health institutions and facilities. And now we see even more in terms of an additional burden to the community, where the knowledge of this transmission is low, the beliefs and the customs is also like impacting more transmission of the disease, and it's also been a bit the international community has come a bit late in supporting this outbreak, and as WHO has really put it now, is actually a collective effort to actually ensure that it's not the transmission is completely broken, so that we stop the
Dr.
outbreak.
Bloomberg, but on such a large scale, we've seen this outbreak occurring in these regions, and as we've pointed out, the poor health facilities. Isn't this just making it worse?
Yeah, I think one needs to step back and see why this is happening. And why it's not coming under control. So there's intense household transmission when people are caring for patients in the home setting. There's intense transmission or opportunities for transmission in preparation of bodies for burial in accordance with traditional practices. And in hospitals where there are very poor infection control programs in place, healthcare workers are being infected who are caring for these patients who may not suspect them of Ebola. Symptoms are very non-specific. So you have this intense transmission. And then you have a very mobile population who might come and assist with the burial processes, who then go back to their own places. Could be, many, many kilometers away. They become ill, and so the process continues.
Now, we've seen some of these countries declaring a state of emergency. Nigeria is the most recent one. Liberia has done that, so has Sierra Leone. Is this going to help to contain the situation?
I think it's a good gesture from the governments that they're doing something really seriously. We'll have to wait and see how it actually impacts the ongoing outbreak. We cannot say now it is good or bad, but as time goes, it will actually show if this impact is useful. What we are doing so far is, I think, one of the things that is also required now is to really mobilize in mass awareness of how the transmission is spread, health education, information to the public of how this transmission is spread, so that they can actually be able to cut off the transmission.
Dr. Baba, I'll turn to you now. WHO is pegging the number at approximately 1,000. Now, my question is, how are you getting these figures? I mean, considering some of the labs in these countries are not fully functional and they don't have the right kits. And apart from that, there are also people in the far-flung rural areas who probably haven't been tested. So how are you coming up with this figure of about 900 to close to 1,000?
Yes, WHO has set up a series of mobile labs and treatment centers across the affected areas. As of early August, we have 8 treatment centers. They're set up very close to the areas of transmission, particularly within the cross-border areas. We also have 5 mobile labs, and this is helping us to quickly confirm the diagnosis.
But what about the far-flung areas? How are you covering those areas in terms of collecting data and statistics?
Well, we have people deployed all over the country. As you know, this is a very complex epidemic. It's occurring in rural areas, urban areas, cross-border areas, and now in Nigeria. So we're doing our best to work with the health system to be able to train health workers to identify quickly, detect, and confirm cases in rural areas.
Dr. Bloomberg, maybe you can talk about the porous borders in West Africa. How is this going to affect the outbreak of Ebola?
Well, you know, you mentioned the closing of borders. Clearly, you know, those are the official borders to stop movement. But the borders are very porous. It's a very mobile population. I think it's important to keep track of contacts of patients so that you can monitor them. And when people cross borders, it's much more difficult. And I think cross-border spread, because of people attending funerals and helping with bodies for preparation for burial, have contributed to people going across borders into very distant areas and then starting the outbreaks there.
Well, do stay with us, and when we come back, we'll continue our discussion on Ebola and Africa's efforts to combat this deadly disease.
If we do what we know best right now, it's still important, and it's still possible that we stop the transmission.
Welcome back. You're watching Africa 360, and today we're looking at Ebola, which has claimed hundreds of lives in West Africa. And we're also looking at the international community's response to the disease. Dr. Bloomberg, earlier on you said this outbreak actually started in December last year. Yeah. Now, without proportioning the blame game, could these deaths, some of these deaths, could they have been avoided?
I would say yes. I think it always takes time for the outbreak to be recognized as a viral hemorrhagic fever. It's very non-specific. Patients may die at home, may be misdiagnosed as something else. And it's not as though the diagnostics for these viral hemorrhagic fevers are easily accessible. So even if you look at other outbreaks elsewhere, there's always some delay in confirming it. But once it gets a name, things could happen, to respond. But yeah.
Dr. Barber, maybe you can come in here. We heard reports about 2 Americans, of course, who were flown back to the United States of America, and they were given an experimental drug, which seems to be working. Why did we only just get to hear about this drug when it came to the 2 Americans and not when the 2,000 or so infected Africans needed the drug?
Well, the experimental drug is relatively new. It's worthwhile saying that there are no vaccines or drugs that have gone through the whole battery of safety, efficacy, and tests for side effects. And there are no drugs that are licensed or registered by national regulatory authorities. So this was really a case in which the NGO negotiated the use of this drug with the private firm.
Has it been done previously that experimental drugs can be used during an outbreak?
To my knowledge, no. But the panel is looking at 3 important questions in such an event. The first question is about safety and about the ethics of using experimental drugs in an emergency outbreak situation where such drugs have not been demonstrated as fully safe and effective. The second question is about informed consent. The principle that we're operating on is one of compassionate use, where a physician can provide a drug of unproven efficacy where no proven therapy exists. However, this implies that the patient fully understands the risks of taking a drug that it does not have demonstrated safety and efficacy. And so I think the concept of informed consent is quite difficult. It's very difficult to get this informed consent within an outbreak emergency situation. And the third issue is, of course, these types of drugs, even if we ramp up production, would not be available to everyone. And so there has to be a process to decide who would receive such experimental treatments.
Dr. Bloomberg, what are your thoughts on experimental drugs?
Well, I think just to comment on, following on what Dr. Barber said, we have very limited information on the efficacy of these drugs. There's very small animal studies, and there are essentially 2 patients who've received it. So to draw conclusions at this stage is really quite difficult. And if there are safety issues that might be shown up because you're using it in a larger group of drugs, in this very difficult situation of the outbreak where there's a lot of mistrust, it could really cause a lot of harm to the whole outbreak response and patient management situation. So one has to be fairly sure that you're not going to make things worse.
And I think I also go along what you're saying here, because I think the 2 Americans receiving this drug is something important that also Doctors Without Borders is following very closely. And as soon as this drug is given the WHO's mandate and Ministry of Health in those particular countries, possibility of, let's say, authorizing this drug. But I think it's very important that we continue to do what we know that is best and has worked previously. Doctors Without Borders has managed Ebola outbreaks in Uganda and in DRC. And if we put all our resources in doing the treatments, managing the treatment centers properly, trying as much as possible to mobilize resources and people to actually pass those messages that is important to cut off the transmission, disinfection that is necessary, health education and awareness to the public as much as possible. If we do what we know best right now, it's still important and it's still possible that we stop the transmission.
Now, there are growing concerns, of course, that the Ebola virus can actually spread beyond West Africa, beyond the continent. We've heard about border controls. Even within the continent, countries such as Zambia is not allowing people from affected areas into their country. Is this enough, actually, to stop the curb or the virus spreading to other parts of the world?
So I think the risks are really in the region, where there's a lot of cross-border travel. Through the declaration of the emergency, there are obligations placed on the country for exit screening, for stopping contacts from moving across borders. Obviously there's some limitations to all of those processes. But there are also recommendations to countries who might be at risk about how they can reduce well, not so much the introduction, but the problem that happened in Nigeria, but recognize cases, make sure that there are protection of healthcare workers who may have to deal with a suspected case, and that you don't get further transmission to unprotected healthcare workers, as it probably happened in Nigeria, and it's caused the problem there.
Dr. Barber, Mr. Kambaki did mention the other outbreaks previously in Uganda and the Democratic Republic of Congo some time back. And now, of course, we have the one in West Africa. Are there any lessons that were learned from the two previous outbreaks?
Well, I think it's very interesting because this is the first time we're seeing the outbreak in West Africa, the Ebola outbreak. And this is one of the challenges that we're facing because it is unfamiliar to both the communities and the population. In Central Africa, they have experienced many Ebola outbreaks. The communities know what the symptoms are. They know they have to contact the health facilities immediately. However, in this case, in West Africa, neither the communities or the health workers were really prepared to respond to this epidemic. They were completely unfamiliar with it. And I think that's one of the biggest challenges. But the experience from the experience from Central Africa indicates the critical importance of the community in supporting the outbreak response. The community leaders knew to cooperate with the health system. The community members were able to identify the symptoms and get outbreaks under control quickly.
Dr. Bloomberg, early on before the show, you were telling me about mobile laboratories from South Africa. Just give us a bit more details on how exactly will these work when they get to West Africa.
So the NICD has a high security laboratory in Johannesburg, and they will leave probably in the next week to Sierra Leone and set up a mobile laboratory to support what's already been done and provide a on-the-spot diagnosis, really to exclude or confirm the diagnosis in suspected patients before they're admitted to these treatment centres. So I think it really, really helps in patient management. And they're very safe laboratories, very skilled people, and I think they'll make a huge contribution to outbreak control, hopefully soon.
And finally, Dr. Barber, it looks like this is far from over. Any estimation of time, the time frame from the WHO, when they'll be able to contain this outbreak?
The WHO is really not projecting an end to the outbreak. We know that there's a lot of work yet to do. We have to wait until we have essentially 2 incubation periods following the last detected case. So it takes about 42 days after we find the last detected case. So we know that we're far from that point.
Well, that's all we had for you right now, and that brings us to the end of yet another edition of Africa 360. I'd like to thank all my guests for taking part in our discussion. You can join the debate by liking our Facebook page or tweet us your views at Africa360_ENCA. You can also send us an email at africa360@enca.com. So until next time, it's goodbye for now.